Hi, and welcome back to another segment of It's All About Helping People. I'm your host, Brandy Fontenot, and today we're visiting with Dr. Christopher LaGraze, whose practice is located on Hospital Drive, just behind Lafayette General Medical Center. Dr. LaGraze, thanks so much for having us.
Thanks for having us.
Now, you are a vascular surgeon, correct?
That's correct.
And I'm sure there's many things that you do, but today we're going to talk about varicose veins.
That's absolutely correct.
Okay, and I'll start off with the number one question. When you see them, obviously you know what they are, but internally, what is going on? What are varicose veins?
Well, varicose veins are veins that develop in the legs because of abnormal flow. Everybody has veins in their legs to bring the blood back to the heart, but some patients have vein segments in their legs where the blood's just not flowing properly and actually backs up. And as time goes on, these veins start to stretch, and as they stretch, they become large, bulgy varicose veins.
And again, aside from the unsightliness, they're quite painful, correct?
Well, some patients don't have pain, but most patients develop symptoms that range anywhere from dull achiness to burning to heaviness at the end of the day. Some patients have leg swelling. Some patients that have had them for a long time can actually develop much more severe symptoms. One
would think. Now, who would be a typical candidate to develop varicose veins? Is it something that's hereditary, or is it something that's more gender-friendly to males or females?
Well, varicose veins are actually quite common. In fact, a quarter of the women may develop varicose veins in their lifetimes, and up to 15% of men can develop them. Maybe about 3/4 of the patients with varicose veins have someone in their family that's had them in the past. And so there's certainly a hereditary component to it. Other factors that help or predispose to varicose veins include pregnancy. A lot of women will get them after they've had 1 or 2 children. Prolonged standing or sitting can lead to varicose veins. Obesity and sedentary behavior can also lead to varicose veins.
Now, I know at one point in time there was the vein stripping procedure that took place. Tell us a little bit about that versus what you do now to treat varicose veins.
Well, the old-fashioned way for treating varicose veins was vein stripping. There was a long time where doctors really didn't consider varicose veins as a very severe or serious medical problem. And when they did treat them, they used vein stripping, which basically involved making an incision in the groin and at the knee using a device that pretty much ripped the vein out. It was a hospital procedure. It required a couple of days in the hospital and took about 4 weeks to recover.
Now, what do you do now for treatment? That obviously that sounds gruesome and horrible. I'll be quite honest with you, and maybe it was and maybe it wasn't. But you have a laser technique that you use now, correct?
That's correct. Well, the new way of fixing this is with the laser, and so what we do is an in-office procedure where the patient is actually awake and mildly sedated. We use numbing medicine so they don't feel any pain during the procedure, and we use a small needle to access into the vein. We slide a laser fiber up the vein towards the groin area. When the laser is activated, the heat from the laser seals the vein off. So as we pull the fiber back, the vein is sealed shut behind it, requiring no major incisions and not requiring any stripping or severe pain that was related to that old procedure.
And that bulginess that you typically see on patients with very severe varicose veins, that goes away following the procedure?
Most of that goes away following the procedure. Occasionally, we have to do a technique called microphlebectomy, where we make very tiny incisions over the varicose veins to remove those bulgy veins. As you can imagine, after years and years of those veins being stretched out, they're too deformed and too large for the body to be able to resorb them by itself. So sometimes we do an additional procedure to remove some of those bulgy areas.
Well, Dr. LaGraze, what is the recovery time on the laser procedure?
Actually, the recovery time is excellent. Most patients, or all patients, walk out of the office after the procedure. Usually within 1 or 2 days, they're back to their regular activities. We usually have our patients remain fairly active after the procedure to avoid any post-procedure complications, and most patients are walking up to a mile on the next day.
Do they have to wear the stockings after the procedure?
Well, that's a good question. Nobody likes to wear the stockings. We usually ask the patients to wear the stockings for 2 to 3 days after the procedure, at which point we have the patients come in and we check them to make sure that there's no complications with the deep venous system. After that point, they usually wear the stockings only during the day for about 4 weeks. And when they come in for their final visit, most patients can put the stockings on the shelf and they never really have to wear them again.
Wonderful. Well, basically from the laser procedure down to not having to wear the stockings hardly at all, it sounds relatively painless and something that people should definitely take advantage of and not have to suffer and continue fighting the battle of the varicose vein. We're very fortunate to have one of your patients who's going to be visiting with us and give us a testimonial on what she's been through prior to having the procedure up until now and where she's at in life now. We thank you for joining us, and we want you to call Dr. LaGraze's office certainly to set up an appointment, and if you have any questions, his staff will be sure to help you. Dr. LaGraze, thanks so much for joining us.
Thank you so much for having me.
With Dr. Christopher LaGraze and LHC Group, it's all about helping people. Thanks for tuning in and have a great day. God bless.
Hi, my name is Judy Bailey, and I've had varicose veins for the past 38 years. I had my first one when I had my first child, and then I had 5 pregnancies after that, and so they continually got worse. When they were really bad, I wore support hose most of the time, and I did live in Texas, so during the summers it was very hot and extremely uncomfortable. The pain in my legs at times felt like toothaches, but it just became a part of my life, and so I just really put up with it for years. I met Dr. LaGraze, I guess about 6 years ago, and he told me about the procedure. I thought about it for several years because I had had the varicose veins, I guess, was such a big part of my life for such a long time. And so I came and did a consultation. He told me the procedure. My legs were so bad that he suggested to do the left leg first because it was the worst one. And so we made an appointment, and in April of 2006 I came and had the procedure done. It was done on a Friday afternoon. It didn't take very long. I was in sort of a twilight sleep, so I could kind of hear what was going on, but when it was over I really didn't remember very much. It took about 2 days and I was back to my normal activities. I normally walk about 2 miles a day, and I started doing that again. My legs were, it was unbelievable. I could tell the difference almost immediately. By the time the end of the evening came, they felt good. I used to have what was kind of like a toothache sensation, and that went away. Then in October, I scheduled and came back and did my right leg. It wasn't quite as bad, so the procedure didn't take as long. I still had a 2-day recovery. After 2 days, I was still doing my normal activities. Years ago, I never wore skirts, I never wear shorts, so I went out and actually bought some skirts, bought some shorts. It was a very different life for me, and I've really enjoyed it. The procedure was not bad. I would recommend that you not wait so long to have it done, but I felt very comfortable in the office. The staff was really good, and the procedure just went really good, and I was very pleased and really wished I had done it before then.